Welcome to BanishCancer channel. Let me start with a question. What if the signs of a serious blood cancer look like everyday problems, fatigue, bruises, or a fever? For many families, that's the hidden danger of acute lymphoblastic leukemia, or ALL. Today, we'll uncover what ALL is, the symptoms to watch for, and why early action can save lives. Acute lymphoblastic leukemia is a fast-growing cancer of the blood and bone marrow. It begins when immature white blood cells, called lymphoblasts, multiply uncontrollably. Instead of protecting the body, these abnormal cells crowd out healthy red blood cells, platelets, and normal white cells. The result is a chain reaction: anemia, infections, and bleeding problems. ALL is the most common leukemia in children, but adults can develop it too. The good news is that survival rates are high when it's caught early, which makes awareness of symptoms absolutely critical. So what are the warning signs? Let's walk through them. First, persistent fatigue and weakness. This isn't the kind of tiredness you shake off with a nap. It's exhaustion that lingers, caused by a shortage of red blood cells carrying oxygen. Patients may feel dizzy, lightheaded, or short of breath, even after simple activities. Second, frequent fevers and infections. Because ALL disrupts normal white blood cells, the immune system is weakened. A child or adult who seems to catch every bug going around or who has fevers that don't resolve may be showing an early sign. Night sweats and loss of appetite often accompany these infections. Third, easy bruising and unusual bleeding. Low platelet counts mean the blood doesn't clot properly. Nosebleeds, bleeding gums, or prolonged bleeding from small cuts are common. Tiny red or purple spots on the skin, called petechiae, are another clue. Fourth, swollen lymph nodes. These may appear in the neck, armpits, or groin, but can also develop deeper in the chest or abdomen. They're often painless, which makes them easy to overlook. Fifth, bone or joint pain. Up to half of patients report aching bones or joints, caused by the buildup of leukemia cells inside the marrow. This pain can be mistaken for growing pains in children or arthritis in adults. And finally, abdominal discomfort. An enlarged spleen or liver can cause bloating, fullness, or unexplained weight loss. Now here's the challenge. Each of these symptoms on its own could be explained by something else. Fatigue might be stress. Bruises could be from sports. A fever might be the flu. But when these signs persist, or when several appear together, it's time to take them seriously. So when should you seek medical attention? If fatigue is constant, if infections keep coming back, or if bruising and bleeding seem unusual, don't wait. A doctor can order blood tests and, if needed, a bone marrow exam. These steps are straightforward but life-saving. Why does early diagnosis matter so much? Because it changes outcomes dramatically. In developed countries, children diagnosed early with ALL have an 85 to 90% 5-year survival rate. Adults face a tougher road, but early treatment still improves chances significantly. It's also important to know that ALL has subtypes. B-cell ALL makes up about 85% of cases, while T-cell ALL accounts for around 15%. Identifying the type helps doctors choose the right treatment, which may include chemotherapy, targeted therapy, or stem cell transplants. Let's pause here. Think about what we've covered: fatigue, infections, bruising, swollen nodes, bone pain, abdominal changes. These are the body's warning lights. They may look ordinary, but together they can signal something serious. And here's the hopeful part. ALL is aggressive, but it's also one of the most treatable leukemias. Advances in therapy mean that many patients, especially children, go on to live full, healthy lives. The key is catching it early, listening to the body, and acting quickly. So if you take one thing away from today, let it be this: don't dismiss persistent symptoms. Trust your instincts, ask questions, and seek medical advice. Awareness is the first step towards survival. Thank you for joining me on the BanishCancer channel. I'll see you next time as we continue to bring clarity, compassion, and knowledge to the cancer journey.